This is not a story about budgets. This is not about appropriations, continuing resolutions, or legislative procedure. This is a story about a single, terrifying number. $22,000. That is how much more a middle-class American couple is now facing just to keep their health insurance next year, all because Washington decided to gamble with the Affordable Care Act subsidies. And right now, as the government shutdown enters its longest phase in modern history, one side of the aisle, your Congress, just stood up and explicitly let that happen. The fight over funding has now officially become a fight over whether millions of Americans can afford to stay healthy, and the latest twist from Capitol Hill proves that the political betrayal is now complete. This is the Trump shutdown disaster, and it hits your wallet harder than anything we've seen in a decade. For the last 40-plus days, we've watched this shutdown escalate from a typical partisan squabble into something genuinely destructive. You know about the flight delays, the SNAP benefits running low, the federal workers going without pay. But those are just symptoms. The disease, the core political calculation that caused the final deal to crumble last night, was the Affordable Care Act, or ACA. The specifics are this: the enhanced ACA premium tax credits, which were established in 2021 and extended through 2025, are set to vanish completely. These credits were essential because they capped how much a subsidized household had to pay for a benchmark plan, and crucially, they eliminated the subsidy cliff for middle-income families. Here's the context. Republicans, led by President Trump, want a deal to open the government, but they are absolutely refusing to extend these enhanced tax credits that keep insurance affordable for over 20 million people. The failure of the recent Senate package to guarantee an extension of these credits, instead offering only the promise of a future vote on the bill to guarantee an extension of these credits, instead offering only the promise of a future vote on a policy that directly affects millions, was a total surrender. The reason for their hard stance? Analysts estimate that for an older, middle-income couple earning around $85,000 a year, the return of the subsidy cliff, combined with rising premiums, would result in annual health insurance costs skyrocketing by over $22,600. That massive financial shock, which would hit nearly 5 million people in 2026, became the line in the sand that Congress was unwilling to cross, plunging the shutdown into further chaos. To truly understand the betrayal, you have to understand the mechanics of the ACA subsidies. It's not just for the very poor. In fact, the middle class, especially older Americans nearing retirement, stand to lose the most. The enhanced credits, which were put in place during the COVID era and extended through 2025 by the Inflation Reduction Act, removed what was known as the middle class cliff. Before, if your income was over 400% of the federal poverty line, say you're a retired couple living on a fixed income of around $85,000 a year, you were cut off completely, losing eligibility for any subsidy. The enhanced credits fix this by capping what any household had to pay for a benchmark silver plan at 8.5% of their income. That's what kept premiums manageable for millions of middle-class families, small business owners, and those nearing retirement. When Congress refused to include the extension of those credits in the bill to reopen the government last night, they didn't just kick the can down the road, they set the demolition timer on the financial stability of millions. Take that 60-year-old couple, for example, the ones we based the title Shock on. They're earning just a bit over that 400% poverty line. Right now, thanks to those credits, their annual health premium is capped and manageable, costing roughly 8.5% of their income. But if those credits expire on January 1st, they will lose the cap and have to cover the full unsubsidized cost of their plan. Because premiums naturally rise drastically with age, and because insurers are already proposing steep rate increases for next year, the amount they have to pay annually is projected by analysts to increase by over $22,600. Think about that number. That's not a copay. That's not a deductible. That is $22,000 ripped straight from the budget of a fixed-income retirement couple, bringing their health insurance costs up to nearly a quarter of their annual income. This catastrophic spike is why House Democrats felt they had no choice but to say, the fight ends here. The moment the deal died on the House floor, the political recriminations exploded. House Minority Leader Hakeem Jeffries, whose caucus led the final blockade against the Senate-passed compromise, immediately accused President Trump and the Republicans of trying to hold the entire U.S. health system hostage, sacrificing millions of Americans' financial security merely for a non-binding promise of a future vote on the ACA subsidies. On the other side, Republican leaders, including House Speaker Mike Johnson and Senate Majority Leader John Thune, swiftly accused Democrats of prolonging the shutdown, already the longest in history, purely for political gain ahead of the midterm elections, arguing the Democrats were punishing federal workers and food aid recipients just to keep a single negotiating chip. But the most fascinating and consequential part of this breakdown wasn't the entrenched opposition, it was the defection that allowed the compromise to advance in the first place. Remember, the Senate needed 60 votes to move the measure forward. They secured those votes because 8 moderate and retiring Democrats broke ranks with their own party leadership. This group, which included influential senators like Jeanne Shaheen and Dick Durbin, faced intense blowback from progressive colleagues like Senator Bernie Sanders, who called the decision a horrific mistake and a betrayal. The defectors, however, defended their move as a matter of civic necessity. Senator Shaheen, one of the key negotiators who had been working on bipartisan solutions for weeks, publicly stated, "This was the only deal on the table. Waiting longer would just mean more harm." They faced a terrible choice. Prolong the shutdown, deepening the misery of unpaid federal workers, delayed travel, and frozen food benefits like SNAP and WIC, hoping to gain leverage for a guaranteed healthcare extension, or take the deal, open the government, and secure crucial provisions like back pay for furloughed workers and protection against further mass firings by the Trump administration, but abandon the single most important policy demand their party had. 8 of them chose to prioritize the immediate reopening of the government, essentially accepting the Republican wager that millions of Americans will now be facing that devastating $22,000 health premium shock in the new year. Their choice ended the longest shutdown, but it fractured the Democratic Party and pushed the core healthcare crisis onto a fast track for a December vote with no guaranteed outcome. And the consequences stretch far beyond the Millers. Policy analysts from the Urban Institute and the Commonwealth Fund project that if these subsidies are allowed to expire on January 1st, nearly 5 million people will lose their health coverage entirely in 2026. This isn't just a political crisis, it's rapidly escalating into a national economic contagion. The loss of that federal funding and the drop in consumer purchasing power will ripple outward, translating to billions of dollars in lost revenue for hospitals, doctors, and pharmacies. We are talking about a projected collective loss of over $40 billion in state economic output and close to 340,000 jobs lost nationwide because of the shockwave hitting the healthcare sector and consumer spending, with the deepest job cuts expected in non-Medicaid expansion states like Texas and Florida. This is the true definition of a disaster, a failure of politics that creates a humanitarian and financial crisis. So what happens now? The ball is back in President Trump's court, but the legislative battlefield has dramatically shifted. We've seen Trump renew his calls not just to let the subsidies expire, but to dismantle the entire Affordable Care Act, frequently promoting what he calls Trump Care, a model that would push money directly to consumers to buy insurance. While framed as consumer empowerment, critics argue this approach would ultimately leave millions of older or sicker Americans exposed to crushing high-premium, high-deductible plans. House Democrats, however, have doubled down, showing they are willing to continue to block subsequent funding measures until they get the health care extension they want. The Senate moderates may have provided the Republican leadership with cover to reopen some departments temporarily, but the core issue remains unresolved. This means the narrative has hardened. This is no longer about a budget. This is about healthcare affordability for the middle class. It is about the ability of the American middle class to afford a life without the fear of medical bankruptcy, a battle where a political system so broken is literally willing to inflict financial devastation on millions just to win a procedural point. This is the enduring reality of the Trump shutdown disaster. We have shown you the staggering numbers: $22,000 more for a fixed-income couple, 5 million Americans facing the loss of coverage, and 340,000 jobs on the line. This fight isn't happening in some far-off committee. It is happening right now in your community, in your family budget, and the health bills you'll face come January. If you are one of the millions of people who rely on the ACA for affordable coverage, or if you know an elderly parent who is suddenly staring down a 5-figure premium increase, this is the time to make your voice heard. We want to know your thoughts. Do you think the Democrats were right to block the Senate deal and risk prolonging the shutdown to secure the healthcare subsidies, or should they have compromised to get the government reopened immediately? Drop your comment below and tell us where you stand. It takes literally 2 seconds. Smash that like button to boost this report and help others see the real cost of this shutdown. Hit subscribe and ring the notification bell so you don't miss our immediate breakdown when Congress finally returns to vote on healthcare. And please share this video with someone who needs to understand how this political fight directly affects their wallet. Your support is what drives independent news that reports the truth about the money and the politics. Thank you for watching, and we'll see you in the next update.